So when a patient approaches us for aesthetic treatment concerns, we always advise them to book in for what's called a skin repair consult first. At that appointment, we will address what their main concerns are, take a series of photographs of their face in various actions to work out what's going to happen as they progress in time. So often a patient will come in with specific concerns, but it's not until you look at the face in a whole and understand their background medical history, their previous treatments they may have, their history of sun damage or skin cancers. It's all important to be approached from a holistic medical basis. Just treating one line of wrinkle is not going to produce a natural result and can actually result in something that looks artificial. So that skin repair consult is very important at the beginning to establish what the patient's aims are and what we can offer them. Most patients will come out of that consult with a treatment plan and a skin rejuvenation approach, which will involve using derma rollers and antioxidants on the skin to improve their skin before they get any type of injectable or other non-surgical treatment. So that is a very vital plate. There's no point getting the patient injectable treatment without them prepping their skin and improving it before they start that process. So that then involves them having a treatment plan which they can work for and budget for over a period of 12 to 18 months. And that way you get a nice natural result, not a sudden dramatic change that everyone will notice.